Hi guys, Derm Dad here. I want to take a few minutes and talk about skin tags. We have a lot of people that come into clinic, various kinds of skin tags that they'd like removed. They bother them, they get caught on clothing, they can bleed, can be a nuisance. They can also get infected and inflamed. Sometimes these skin tags can be painful, especially if they're infected. So a lot of times patients come in asking to have these skin tags evaluated and potentially removed, really just to minimize these kind of issues that they're having. So skin tags can be removed or treated using multiple different ways. If they're small, we can treat skin tags with liquid nitrogen. So we just take a freeze gun essentially and spray the liquid nitrogen onto the skin tag. It freezes it, takes about 5 to 7 seconds. And what happens is the cells die off from the extremely cold liquid nitrogen, and the skin tag should blister up, scab up, and should peel off. Usually it takes about a week or up to 2 weeks for the skin tag to actually come off. So liquid nitrogen is quick. It works well for small skin tags. The drawbacks is that it stings a little bit. It's a little painful. It's not bad though. And the second thing really is, one has to be real careful using liquid nitrogen. You really want to just spray the skin tag itself and try not to hit a lot of the skin surrounding it, as treating the skin around it can cause a little light discolored area down the road. So it can leave a little mark essentially. Sometimes that mark can also be hyperpigmented or darker than regular skin. So it can leave a light mark or a dark mark. So depending on where the skin tag is, it may or may not be the best option. Also, if the skin tag is really small, we're talking about tiny, in that case it's also hard to hit it with the liquid nitrogen without hitting a lot of the surrounding skin. So those are considerations for using liquid nitrogen. Another option is simply just snipping it off. So that works well. If the skin tag is on the really small side, we're talking about tiny little skin tags, we can use a sterile scissor and just snip them off at the base. It stings for half a second, but it's really not bad. Works well for those. Now, if the skin tag is larger, say medium size, in that case, you probably want to anesthetize it with a little numbing injection. We use lidocaine or lidocaine with epinephrine. And then if you have a really large skin tag, we see skin tags that are the size of your pinky finger or larger, really. In that case, you definitely want to anesthetize it. Certainly can't snip those off without some kind of anesthetic. Now, keep in mind the medium and larger ones are going to tend to bleed some. It's not problematic, but we do need to stop it somehow. There's different ways to do that. We can use a topical solution called aluminum chloride, which can stop the bleeding. It takes a few seconds, and we just apply it with a Q-tip. If the skin tag is larger, we may need to use electrocautery. So that's just a device we use with a little tip on it, and it cauterizes the area that was cut off, and it stops the bleeding. So both of those work well, but especially with cautery, you definitely need anesthetic on board. Otherwise, it can be painful. So there are other ways to remove skin tags. There's folks that'll tie strings around them at home or use a nail clipper or that kind of thing. We don't advocate that, although people do use those methods, and sometimes it works for them. But there can be complications. You don't want to get in a situation where a skin tag becomes infected and it causes surrounding cellulitis or other problems. So best method, really, either freeze them off or snip them off, both in the clinical setting, which is controlled. Skin tags generally don't need to go to pathology. If it's an obvious skin tag, hasn't done anything dramatic, changed or anything like that recently. If you have a larger skin tag-like lesion, it would be considered a neurofibroma as a potential option. So there, it might be worthwhile sending it to pathology. And rarely you can have cancerous lesions that look like a skin tag. So there can be a thing called a polypoid melanoma, which is a cancer, and it can form like a raised skin tag. Most likely you're going to see something like that pop up and then start enlarging and start dramatically changing over a matter of weeks, if not months. So if there is any kind of concern for melanoma or other kinds of rare skin cancers inside of a skin tag, based on history or based on the way that it presents, it may be worthwhile sending it to pathology. It never hurts to get it checked. So my suggestion is if you go into a dermatologist or any doctor and have a skin lesion removed, and if you are concerned about it for whatever reason, just share that with them. Most of the time, in my experience, at least in our clinic, if someone wants a lesion sent to pathology, I'm more than happy to do so. It's always better to err on the side of being safe versus sorry. If you do have a skin tag or any skin lesion removed and it's not sent to pathology and it grows back, especially changing bigger than before, causing problems in terms of pain, bleeding, that kind of thing, then that definitely would be a reason to have it checked again. So in my case, if a lesion has been removed for whatever reason and it recurs, and this time it's coming back faster, bigger, bleeding, looks worse than before, I would definitely remove it a second time and this time send it to pathology irrespective. So that's my take on skin tags. Very common. So patients are often interested in what causes skin tags. Fact of the matter is a lot of it can be genetics, but it can also be areas of friction. So a lot of times in folds where the skin is rubbing against each other, it's easy to generate skin tags from that. There are some syndromes that are genetic where people get skin tags, but I would say it's a combination of friction and a person's genetics in terms of forming skin tags. So, if you're able to use some kind of a powder or moisturizer to minimize friction, that definitely would help. So that's skin tags in a nutshell. Hopefully this helps. If you like the video, you're welcome to subscribe. Definitely leave any comments or questions, and if I can, I will try to address them. Otherwise, stay safe and thanks for watching.